With our scout film, go ahead and roll onto your back. A scout is going to be a KUB. Okay? Where do we center for a KUB? At the crest. Exactly. Take a deep breath in, blow it out, hold it, beep. Okay? That's going to be our scout. All right. Then our AP or our PA, after we do the contrast, this is gonna be the same. It's a KUB. Okay? We will then do an LPO and an RPO. So, start that way. Okay, 45 degrees. Okay, you're gonna be centered at the crest, and then you're gonna be about 2 to 3 inches medial to the upside ASIS. So center at the crest, find the ASIS. About 2 to 3 inches medial, okay? All right. For the LPOs, we are looking at the hepatic flexure. For the RPOs, we're looking at the splenic flexure, okay? But for both of them, you will be centered at the crest, and then you will go 2 to 3 inches medial of the upside ASIS, okay? So for an RPO, this line, okay, centered at the crest, and then we find her ASIS, and I'm gonna be 2 to 3 inches medial to upside ASIS. Okay, take a deep breath in, blow it out, hold it, beep. Okay. There's an AP axial view. You'll hear it as the sigmoid or the AP axial. Go ahead and lay it on your back. This one is going to be a 14 by 17 also. This one, however, has a 30 to 40 degree caudal angle. No, I'm sorry, cephalad angle. I was like, caudal doesn't sound right. What happens to my light when I start angling this much? It gets bigger, right? So we can collimate in, okay? All right. So we are going to find the ASIS, and I'm going to be 2 inches below the ASIS. But I'm going to be centered right in the middle. Okay? Hold your breath and beep. And that is the sigmoid or the AP axial. Sigmoid or AP axial. Yeah, I think in your book it says AP axial, but you'll hear it in the film a lot of sigmoid. Alrighty. A lateral. When you do air contrast BEs, you will do the lateral rectum as a decubitus. For single contrast BEs, they will just do it as a regular lateral, okay? So go ahead and roll onto your left side. Let me show you. Okay, so for your lateral rectum, we're gonna be 10 by 12. Portrait. We're gonna find the ASIS because that's what we wanna be centered at. But then we wanna go posterior, probably about 2 inches. You typically wanna be between the ASIS and the sacrum, okay? So you're about 2 inches or so posterior to ASIS. Okay. So this will be your lateral rectum. Hold your breath and beep. And then for air contrast BEs, we always do decubituses. You guys remember how to do decubitus abdomens, right? Do we need to show you, or do you guys remember those? Where do we center?
We should run through it.
Yeah, we can run through it, okay. This one said center at ASIS, but really, or these decubes you can center at the crest because we're not necessarily looking for diaphragm, we're looking for, the air in the valves.
So it'd be fine to go at the crest?
Yeah, it would be fine, if you guys went at the crest and 2 inches above, I'm not gonna let you off on either one. But at the crest is fine for these ones. I don't wanna blind you, don't look, close your eyes. Okay, I wanna be 14 by 17. Go ahead and scoot back on the table just a little bit. Oopsie, sorry. Okay. Find the crest. I'm going to center at the crest. What marker goes here?
Left, right. Left, it's a left.
It's the patient's right
The right side up.
Oh, Lord, have mercy. Can somebody hold this? It's the right marker, it's still the patient's right side of the body. Alright, so I'm gonna go up here, make sure my lights are inside the cassette. And I'm gonna bring this down and then open this one up. Put my right marker right there.
You said you put it at the crest or the?
I put it pressed down. So this one, deep breath in, blow it out, hold it, beat. So you will do this decubitus. Okay? You will do the other decubitus, roll towards me.
Are you doing all this when they have their probe in their rectum?
This is all one that's in the rectum. So this is what I'm saying, you guys gotta be fast, okay? I need to straighten this one out.
Move the tube around.
Yes, yeah, cause I don't want their legs to be kicking that tube
Falling out.
out.
Is there
Okay?
usually just one tech or two?
Well, if you guys, if your department can spare an extra tech at the time, it's helpful, but it just depends on your staffing and there's many times I've done these all by myself. But it's helpful when you have somebody else, you know what I mean, cause you can, one can be moving the tube while the other one's getting the cassette ready. Again, deep breath in, blow it out. Deep, okay? Alright, so those are just at the crest, decubes at the crest. Then we will do our ventral decubus lateral rectum. What's a ventral decubus? Lay on your stomach. Lay on your stomach. This one, so you're gonna be centered at ASIS, so I know if I find the crest and I go down probably 2 to 3 inches from the crest, that should be good. Can somebody hold this?
2 to 3 inches from the crest?
Down from the crest. Right, cause you're centered at ASIS, so if your ASIS is a few inches below your crest, right, top of your
Yeah.
crest? Okay, which marker's going on here?
Left.
Very good. Okay, hold on.
This is called a ventral decubitus.
Ventral decubitus, they're laying on their stomach.
It's like a booty shake.
What's a dorsal decubitus?
Laying on the back.
And they're laying on their back. Okay, so make sure you bring this up to where you're centered and then fix your light so you're not outside the cassette. And then you don't wanna be at mid-coronal plane, you wanna be about an inch or 2 above it. Okay, and I'll just open it up to like there.
So what if they have a big butt?
then you just open it up to your cassette. You don't wanna go to your cassette. But if you think about it, big butts is normally just tissue, right? Just like big boobs, it's normally just tissue, you know? It doesn't change your skeletal.
So you wouldn't have to see like light on the
No.
cassette.
No, so this will be your ventral decubitus, okay? So now I'll say, okay, Amanda, I got all my pictures done. So we did our AP, we did our LPO, RPO, we did our sigmoid, we did both our decubitus, we did our ventral decubitus rectum. Now I'll go ahead and start draining all that contrast out of the back, okay? I'm gonna drain it all out, and then once I drain it all out, and then we'll let you use the restroom, and then I'll bring you back and I will do a post-evacuation film. All that is, it's another KUV, okay? And you'll label that film post-evac or post-evacuation, okay? That is it.